Oh, dear.
Did they cut it? Did they cut it?
Yeah, there's fire.
There you go. Well, listen, this is an exciting day. It truly, truly is here at LDMH. You take a look at the cost of this scanner, but it was all funded by the foundation, so hats off to our foundation people. Was it $1.3 million? One of the things I've always said, and having been your, and still continuing to be your member of provincial parliament for at least the past 5 years, one of the things I've noticed about the town of Leamington, the municipality of Leamington, is that you really get behind your projects, and you really get behind your hospital. And I know we've had some challenges, but we've overcome those challenges over the last few years, and I'm very excited about that. And this is just one more thing that's going to help put LDMH, on the map down here in Essex County and southwestern Ontario as well. I'll let G talk about the technical side of this beautiful CT scanner, but I'm very, very excited to be here and to be a part of this ribbon cutting ceremony. It's really, really exciting. And I know that Terry and I know that board members and the mayor, I'm not going to steal your thunder, but it's really an exciting opportunity for everyone here at the hospital and for the community for this state-of-the-art CT scanner. So again, congratulations to all.
Your Worship.
Well, just on behalf of the municipality, I say congratulations to the board and all the staff and members of the hospital for making this all happen. Lately, over the last, I don't know, I've kind of lost track. When I'm talking about Leamington, I'm usually Facebooking or whatever, saying Leamington leads the way, because every time I look at the news, somebody else in this town is doing something that's beyond what everybody else is doing. And Leamington Hospital has just done that with this machine coming into our town. Again, leading the way. I believe we're one of how many in the entire area?
One of two.
One of two. So that speaks volumes for this town of ours and our hospital. And I will tell you, it's a quick and painless machine. I've already had the opportunity last month, unfortunately, being in here to use it, and it's wonderful. So I look forward to everybody having available access to this, and again, congratulations to the hospital for your steps forward.
Thank you.
As mentioned, the total cost of the project was $1.25 million. I guess the biggest thing is the need for it in the community. We put our first scanner in 2004, and now it's time for replacement. So it's time to get a new one. We want to go with the technology that's going to lead us on for the next 5 to 10 years, rather than just get the basics. So 128 slice from 16 slice, so you can see the big jump in the technology. Huge imaging improvements, which the radiologists and GE will certainly be able to talk to a little bit more and show you some pictures, hopefully, so you can see for yourself. It's absolutely amazing. And we do over 5,000 patients a year on CAT scans, and it's growing and growing and growing. Our wait times are #1 in the LIN, and we're one of the top 10 in the province for wait times. Very, very important. And just to show you how critical this piece of machinery is, when we purchased the new one and we were planning for the installation, originally it didn't look like it was just going to be a few days and we were going to limp through it. When it started to look like a little more than we anticipated, due to some new ministry regulations and hurdles to go over, the hospital panicked. The nurses panicked without a CAT scanner here. It would have been we would have been shipping patients back and forth up Highway 3, 4, 5 times a day for CAT scans. So we had to bite the bullet and get a portable CAT scan in out here, which then we were able to do everything, get it installed right, and I thank the board and the foundation for getting us through that, because it would have cost us just as much money to be shipping those patients up there for that extended length of time. So just to prove how important it is. The staff have been wonderful. They're learning. It's a new experience for them. We've had Lisa go off to Harvard for a little bit of training, and Liz. So I think they're all pretty excited to use it too. They caught on very quickly, and kudos to them through the renovations and etc. So thank you very much to everybody involved. Thank you for our Christmas present.
The Hospital Foundation, on behalf of all of our directors, it's always our pleasure and our purpose to support the hospital in their needs. It's not always this big and glamorous, but it's kind of nice when we get to really see our efforts come alive like this and be able to be used by the entire community. Thank you.
So on the board of directors, we would just like to say thank you to the foundation, and also more importantly, thank you to the community for your continued support. Your support will keep this hospital here and allow us to bring in the latest technology to ensure compassionate care stays close to home right here. Thank you.
If you could introduce yourself.
Hi, thank you for allowing us to be a part of today. My name is Kim Cleven. I'm the CT product specialist for Ontario, and we're thrilled to have this system here in Leamington. This system is really a state-of-the-art scanner, but what's really important is the impact that it has on the community, and some of that was already raised by Rose. One of the big things is the dose reduction. With new advances in technology, we've made a lot of strides, but this scanner has the ability to reduce your doses up to 80% compared to what was on your previous system. So that's really impactful. In addition to that, we have something called spectral imaging, and I know Dr. Cooper has been and the technologists have been scanning some patients with that feature. And spectral imaging is a relatively new technique in the CT community, and up until now it's really been dedicated to those large academic sites or teaching hospitals, but really where it's not just for those sites, it's for all sites and small communities as well. And that's exactly what we've seen here, where we can really expand the access to patients. So I'll give you an example. Sometimes our patients have difficulty and are renally insufficient, so they're not able to handle burdens of contrast that we inject when we do certain types of exams. With this feature, we're actually able to reduce the amount of contrast so that we can actually scan those patients instead of having to send them on for another type of test. So there's many examples where spectral imaging, which is unique to this CT, is really going to help the patient community here in Leamington. So thank you again, and I'm happy to take any questions that anybody would like to know more about the scanner.
So could you explain maybe, do you have a demo maybe on like the artifacts, the kidney
Yeah,
stones,
so
all
we
that?
actually have some, I have this video here that will get playing. And
That's cool.
we're going to try and turn the... So one of the things that I mentioned, this spectral imaging feature, what's unique about this scanner is that it has a detector material in it called the Gemstone detector. And that Gemstone detector is actually the first new detector material that we've seen in CT in the last 20 years. And it's actually man-made garnet, so that's why we call it the Gemstone. And that's what is the driving clinical enabler for this spectral imaging. So that's a huge piece. And this scanner, it is the only scanner with this material in it. As Rose said, this scanner is the first one to be installed in Ontario. We now have 14 of them installed across Canada of this particular model, so that's very exciting as well. From a artifact reduction, it's a huge piece to what we're able to achieve with this, because we can reduce artifacts from metal. So you have many patients that come in with hip artifacts, and we have a difficult time seeing through the bladder or the areas around that. So with this Gemstone Spectral Imaging, we're able to mitigate that. Another example would be in the brain. We often have patients with clips or coils in the brain that are of a metal material, and we actually can't see the vessels around that. So with Gemstone Spectral Imaging, it completely eliminates that. And one thing that's really important when we're doing new techniques in CT is to ensure that we are not irradiating patients more than they need to be. So that is really key. So I mentioned the huge dose reduction that we see. That also applies when we're using these special techniques with spectral imaging. We still have dose neutral cases. This one here is 1.3 millisieverts. That's how we report dose. This particular one is a cardiac exam. Just to put it in perspective for you. So if we're at 1.3 millisieverts for a cardiac scan on this scanner, previously cardiac doses were anywhere from 15 to 20 millisieverts. So huge, huge improvements in the dose that we're giving our patients. And at that, we're seeing a huge increase in the image quality and the information we can gather from that. So there's a number of examples that are coming up on the screen here. That this one is showing that metal artifact reduction, where we can essentially mitigate all of that blooming artifact or that smudging. So that's what Rose was referring to with the metal artifact reduction.
What about the chemical compositions like the kidney stones?
Yes, so that's another one that we're seeing here, where we now have the ability to actually drop a region of interest on a particular lesion on an image, and as a result, the system can then tell you exactly what it's made of. So many kidney stones have different compositions, whether it's a uric acid or a non-uric acid stone. So by telling the physician, now I know this is a uric acid stone, you know the treatment path to follow. So it really helps mitigate kind of that continuum of care.
So there's so many added, so much added value to this scanner and what you're able to see. Does that mean that the patient needs to spend longer for the investigation?
That's a great question. So to also put it in perspective, compared to your previous technology, the scanner was much slower. So the patients had to be on the table longer. Now the patients are off the scanner quicker, and you're getting much more information. And a great example of that is shorter breath holds for patients that are having difficulty holding their breath.
With regards to wait times, we heard that wait times are pretty good already.
Yeah.
I was understanding, but with this now, with the advanced technology, will we be able to find that we'll be able to handle more patients in a timelier manner? And in other words, your patient flow is going to drastically increase. And are you?
Don't give that one to Dr. Hooper.
I mean, the wait times are very good right now. The patients are actually in the scanner for a shorter period of time. There is more post-processing for us to do. We still do that quickly enough, but with this technology, we can just be more confident in saying, I think this is a this, I think that's a that, or I'm not concerned about this, because we can image it looking at all these different tissue types that we couldn't do before. We couldn't separate them before, now we can. And we can just be more confident in our diagnosis in a quicker time with a lower dose of radiation and a lower dose of the contrast.
Well, it sounded to me like you had reduced the dosage of radiation by probably around 93, 94%. Is that The number 1 in 15 was the number
Well,
that you...
and it's all relative. So how we talk about dose reduction, it's compared to using filtered back projection, which is this technique that would have been on your previous scanner. So in some cases you might see a 90% decrease, in some cases you might see a 30% decrease.
Oh, I see.
It depends on the type of exam, how much coverage, and what is being looked at. But typically we see anywhere from 30 to 60% dose reduction. Sometimes we're as high as 90, sometimes we're as high as 80. Depends where your baseline is.
Mm-hmm.
So it'll vary across the types of exams that you're doing. But typically, for example, head doses. This is a very relevant one. I know I've spoken to the group here before. Head doses were probably in the range of about a unit called DLP, in the range of about 1,200. And now they're down in around anywhere from 600 to 900, depending on the patient. So that's a very significant reduction in dose. And our goal as CT manufacturers is to have our dose around 1 millisievert for all types of exams. But of course, when you're scanning patients, not everyone's built the same way. So a tall patient, a short patient, a larger patient, a smaller patient, their dose will vary based on their size.
Going back to your question about the wait time, when a patient comes in for a CAT scan, there's quite a process involved.
Sure.
Actual on the table and through the machine is probably the fastest of all. They have to come in, they have to give them history, they have to get consent, they have to be injected with the dye positioned properly, and then stand. And then there's all of the other, work for the radiologist after for reading it, but usually that's post procedure. Yes, it's faster. Yes, we have capacity here, maybe a little bit with the faster scanning. Our limitation is CTs, we do not get technical revenue for CAT scans. Okay? So we get our wait time funding, which helps us to keep things going. And but without that technical fee, that's why we do outpatients during the day. We don't do them in the afternoon shift. If we were getting full funding, we could add more staff and do it like Windsor does 24/7 because of the need.
And that was the next question I was going to ask, Rose, was are you going 3 shifts or, and so on? Because once the word gets out, the quality and caliber of the new CT scanner, everybody's going to want to go here, right? We're chatting,
They do come here if they can get in faster too. So
yeah.
There are some who happen to wait 2 or 3 days.
Which then ties into, you mentioned earlier about Harvard, so training, staff training, right?
I have a great story about the training because Lisa and Dr. Hooper went down to Boston to do a course specific around spectral imaging, and one of the luminaries, Dr. Sahani, that runs that course, I saw him in Chicago a couple weeks ago, and he sought me out to tell me how impressed he was with their engagement and involvement. And I think that's a real testament to the caliber of clinical excellence here. We have sites that are, large academic teaching hospitals that haven't grasped new techniques like this as quickly as you have here in Leamington. So I think that's great kudos to the team.
Kudos to all the staff. They've all